Hello, hi everyone. I want to thank the Ehlers-Danlos Society for inviting me to speak about mindfulness today. We had some really interesting talks this morning talking about how important mindfulness is. And I want to talk about it in a more practical sense and how I incorporate it into the work that I do with the EDS community. So my name is Jeannie Di Bon, and I'm a movement therapist. I specialize in working with people with hypermobility, EDS, and chronic pain. And I also have hypermobile EDS, MCAS, and POTS. I have no disclosures. So I mentioned that I have hypermobility EDS, MCAS, and POTS. But like many of us in this room, I didn't know that for many, many years. So my symptoms started when I was 12, and I got my diagnosis when I was 48, which is a very long time. I just knew that I was in a lot of pain. I knew I didn't feel right. I knew I didn't feel well. After my second pregnancy in 2006, my symptoms got much, much worse. And it was at that time that I saw a physiotherapist who told me, you must do Pilates. You have to start doing something, because you're literally just hanging off your joints. So I took his advice, and I did some Pilates, and I loved it. You know, the thing I really liked about it was it actually gave me some time to connect with my body. You know, I felt very disjointed from my body. I'd been in pain for many, many years, and I was actually taking time for myself to actually start to feel my body. But it wasn't quite enough. It wasn't giving me everything that I needed. So over the coming years, I attended many, many courses on biomechanics, anatomy, all sorts of different things. I did lots and lots of research, read lots of research papers, and I read literally hundreds and hundreds of books searching for something that would ultimately help me get out of pain and help my clients as I went forward. So I trained. I qualified in Pilates in 2008, started teaching in 2008, and then over the course of the coming years, I was doing all of this research and training. One of the books I read, and you might know this because it's a lovely book, An Unspoken Voice by Peter Levine. Has anyone heard of that book? Anyone read it? It's a really, really great book. So when I was doing my research, this quote really stood out to me. Change only occurs where there is mindfulness, and mindfulness only occurs where there is bodily feeling. And this was really interesting because, you know, I'd only had associations with my body as something that gave me pain, that's something I wasn't happy with. So I was really curious about this, and I kind of realized, well, if I'm looking to create a method, a movement method that helps me, it's going to have some sort of sensation, body awareness included in it. And so that was really, really key for me. So people talk about mindfulness, and as I say, we heard about it a lot this morning, but what is mindfulness? It gets thrown around all the time that we should be doing mindfulness, but what is it? Well, it's derived from the practice of meditation, and it promotes embodied self-awareness so that we really feel things in our bodies. And some of you came to the movement session this morning, and we were really taking that and really starting to feel some embodied self-awareness in our practice. It's the ability to notice our feelings, but not getting caught up in those feelings. So not being judgmental about whether things are good or bad, just noticing them. So we notice the sensations and thoughts, good thoughts, bad thoughts. You know, we have tens of thousands of thoughts every day. You can't stop your thoughts. People think mindfulness is about having a clear mind and not thinking of anything. That's just impossible, and you'll drive yourself crazy trying to do that. So it's about noticing the thoughts, but not actually holding on to them. And it's about training yourself to stay focused on a particular emotion or sensation, even if that sensation isn't a nice one. And it does occur in many movement forms like Tai Chi, yoga, martial arts, and in my integral movement method, which is the method that I created over the course of this research and the coming years. So I've embodied mindfulness into my method. So what's the difference between meditation and mindfulness? Now, when I was preparing for this presentation, I did lots of Googling and looking around. Could someone tell me exactly what the difference was? And nobody could. I couldn't find an article that said meditation is this and mindfulness is this. So there's definitely an overlap between the two. So meditation is the practice of focused concentration. So typically you have a word or a mantra that you repeat over and over again. So as part of my research and my training, I trained in transcendental meditation, and you're given a word that you just repeat over and over again, and that's kind of sends you into this meditative state. So it does quieten down the mind, and it is used in many religious traditions. And there are many, many types of meditation. There's not just one kind of meditation. And mindfulness meditation, I think, is really key to what we're talking about here. Mindfulness is being aware and present in the moment. So how do I feel right now? We're all sitting down. How do I feel right now, sitting in this chair? What's going on for me? And what thoughts, feelings, and behaviors am I having right now? Okay, so I teach movement therapy, so what does that mean in terms of the movement? How do I bring mindfulness into my movement? So it's about being conscious of our patterns and our habits. So we were talking this morning in the practical session about how we maybe have holding patterns and tension patterns in our muscles, in our postures, and we guard and we brace, and sometimes we're not even aware that we're doing it. So it's about becoming conscious that actually we might be doing things that are contributing to our pain, but we're not even aware of it anymore. So, as I said here, it's about noticing that we're holding tension in our body. Maybe my shoulders are up here to my ears. Maybe I'm clenching my jaw. Maybe I'm locking and hyperextending my knees. Maybe I'm guarding. You know, a lot of us brace and guard around our abdomen. That causes breathing pattern dysfunctions. So there's lots of things that we do that maybe have just become so normal to us. I mean, before I got into the movement therapy and, you know, my sort of pre-life, most of my life was spent in this guarding, bracing pattern. I had no idea that it was possible to relax your body. It just was an alien concept to me. So we need to be aware of how we move and how connected we feel. And having the ability to relax and release that muscular tension from our tissues. And that's really, really key. You know, if you were someone like me who held habitual tension in your body, the change that can happen when you start to release that, and it can be quite emotional. You know, I have clients bursting into tears because you start to release things that have been held for such a long, long time. And I think the speakers this morning touched on the topic of trauma. You know, many of us have trauma that maybe is stored in our tissue as well, and when we start to soften the body, that trauma can start to find its way out. So, does this really work? Does mindfulness really work? So there is a lot of research out there. Most of it has been done on meditation, okay? But remember, there is an overlap. You know, they're very similar practices. So this is sort of a summary of the evidence towards practicing meditation and mindfulness regularly. So it increases qualities such as empathy, gratitude, and forgiveness. So practicing gratitude every day can actually be a really, really powerful tool. It can help with sleep disorders, headaches, and reducing stress. And the relaxation in meditation activates the parasympathetic nervous system. And we heard about that this morning as well. So you have your sympathetic, which is your fight or flight, and you have your parasympathetic, which is your rest and digest. So practicing mindfulness can help stimulate that parasympathetic nervous system. It reduces that muscular tension that we were talking about. And that's really, really key. And Herbert Benson from Harvard Medical School was the first sort of researcher who looked into meditation, and he has this thing they called the relaxation response. And he found that it sends people into a physical state of deep relaxation. So it's really, really interesting. And since I prepared this presentation, we prepared them a little while ago, I've done some further research. And there is now evidence, and I think it's from Dan Siegel, who talks about this research, that mindfulness can reduce inflammation in the body, and it can actually change our epigenetics, so how our genes are actually responding, which is really, really fascinating. So it's a powerful tool. Okay, so you may have come across this lovely book called The Body Keeps the Score by Bessel van der Kolk. He's another trauma sort of expert. And he says at the core of recovery is self-awareness. And he says practicing mindfulness calms down the sympathetic nervous system so that you are less likely to be thrown into fight or flight. And that's just perfect for us because so many of us live, as I said, in this heightened state of awareness, tense muscles in our fight or flight. If we can practice something that moves us and shifts our state into a more parasympathetic, a softer approach, it's going to help us with that awareness and our recovery and ultimately our pain relief. So I'm not going to talk about my whole movement method, but I have created this method that I call the integral movement method, or the IMM. And this is what I use with all my patients. So I focus only on EDS and HSD patients now in my clinics and online. So it is Pilates-based because that's what I've trained in originally. But it's very much coming from a rehab and a pain management point of view with this somatic, embodied self-awareness process. Okay, it's not mechanical. It's not about just doing exercise and getting on with your exercises. What we're trying to do is actually create that bodily sensation, because remember what Peter Levine said, healing, we need that embodied self-awareness. We need mindfulness. So we work on the mind first and the body. You can't separate the two. It's got 6 elements, which are listed there, but we're only going to talk about the first 2, breathing and relaxation, which is where and how I integrated mindfulness into this movement method. Okay, but the others, proprioception, joint stability, balance, and posture, come after we've done this element of the movement method. So breath. Why do we spend time looking at breathing? So many of us actually have breathing pattern dysfunction, probably from, there could be many reasons, but sort of top reasons are being in pain, so we kind of brace and guard ourselves because things hurt. Stress, anxiety, trauma, they can all affect our breathing. And so we get these dysfunctional breathing patterns, maybe shallow, quite tense up around in the shoulders, not doing that diaphragmatic belly breathing, which is so beneficial. So a lot of what I do with people and, our first sessions is just oftentimes just looking at the breath. How are people breathing? Are they holding that habitual muscular tension in their bodies? So that helps bring self-awareness. So we're already starting to bring some awareness. And people say to me, gosh, I didn't even know that my shoulders were up to my ears. I didn't know I was doing that. And that's like a massive first step to change. So it has a physiological impact. And it really starts to already improve our proprioception because you're becoming more aware of where your body is in space. It has been proven to reduce pain. Okay, so meditation, they found in that study at Harvard that it can actually interrupt the pain signals to the body. So really, really powerful. And of course, it calms our nervous system. It helps trigger that parasympathetic nervous system. So we spend a lot of time on breath. And we spend time on relaxation. Now, they kind of go hand in hand because once you start working on your breath, you're going to start to relax. You're going to start to feel more at ease in your body. So it's integrated to our breath. It really helps release that muscular and emotional tension that we were talking about. And it helps people recognize those guarding patterns that I was talking about. So once we start to relax, we start to release that tension, we can then start to move on. I'm a firm believer in, I don't jump in and start doing strength work with people because unless we're in the right place, unless our bones are in the right alignment, if we're not in the right place in the first place, just jumping in and starting with a strength training program often isn't going to work out because you're strengthening something that's in the wrong place in the first place, okay? It builds that sensory awareness or that embodied sensory awareness that we were talking about, and it's going to help improve our sleep, which is brilliant because we're going to be more relaxed. And we've talked about that it interferes with our pain signals. So these are the ways that I build mindfulness into my movement method. These are just some mindfulness feedback that I just picked up from some of the Zebra Club members. I'm learning just how much I need to relearn how to breathe and move. So these are from people with EDS or HSD. The resulting awareness is also transferring to other forms of exercise and has significantly reduced my rate of injury. So that's just because they're starting to become more aware of where their body is in space. They're becoming more aware if they're hyperextending their joints. They're just more aware of themselves in general. And I had the easiest time falling asleep last night than I've had in years. And there's that sleep hygiene being improved because we're more relaxed, we're more calm. So just a few benefits there from real people with EDS who are actually practicing mindfulness as part of their movement therapy. Just move this on. So I just want to leave you with this quote from a good friend of mine and an amazing yoga teacher. He wrote this beautiful book. I highly, highly recommend it. If you're interested in movement and somatic experiences, a book by John Sturck called The Original Body. The more you think, the less you feel. The more you feel, the less you need to think. And I don't know about you, but I spent a lot of my time being a perfectionist, thinking too much, trying too hard, trying to control everything I did, and not being connected to my body. But by building those sensory feelings, that bodily awareness, you know, the body is so intelligent, it can take care of things, and I don't need to be up here in my head all the time. So I think that's just a beautiful quote, and I just wanted to leave you with that, just give us all something to think about and feel in our bodies. So thank you so much for listening, and thank you.